This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome to Mon Health Talk for this Monday, and happy West Virginia Day to everyone out there. And we're glad you are with us. I'm Kyle Wiggs sitting in for Dave. He'll be back at about 10 o'clock this morning with Metro News Talk Line. Now, the focus of this morning's program will be the Village at Heritage Point. We have a couple of guests with us. Wilma Sternthal, she's the executive director of the Village, and Jeanette Lancaster is director of sales at the Village at Heritage Point. And ladies, good morning. Thanks for coming in.
Good morning.
Good morning, Kyle.
We appreciate your time. All right, Wilma, let's start with you. As the executive director, give us your background, how long you've been with the Village and some of your duties.
Okay. So I'm in my 20th year. My 7th year as being the executive director. I was the director of nursing for our assisted living prior to that. I have a master's in leadership and nursing administration. I also have a certification as a dementia practitioner, which, always comes in handy anytime you are in a senior living community. I came to Mon Health, I think, with a very persistent previous executive director who was looking for a director of nursing with experience, and I think I was the only game in town. So she called me up and asked me why I hadn't applied for the position she had open. And Mon Health's reputation had a whole lot to do with my decision to join the Mon Health team.
Okay. And Jeanette, same for you. Your background and how long you've been with the Village.
So from Morgantown, I have my degree from Fairmont State in business management, where I was able to oversee the operations for Mon Healthcare, our durable medical equipment company, and was there for 25 years. Been with the Village since January, so not very long, a little bit wet behind the ears still, but enjoying every minute of it. And I don't know, I can't say enough good things about this place.
All right. Well, let's go there. What are the positives about living at the Village at Heritage Point? And Jeanette, since you brought it up, we'll start with you. What makes it a special place?
The community in and of itself, between the residents and the staff. What I hear from a lot of people, and you would experience when you come through the doors, it's very warm and welcoming and just feels like home. We have just so much to offer. Our independent living apartments, we have 2-bedroom, 2-bath, and 1-bedroom, 1-bath apartments that are beautifully decorated, and we're renovating them as they turn over. So as a new resident comes in, they have, fresh paint, brand new carpet, new kitchen appliances. It's absolutely gorgeous. Our independent living just provides folks with all of the safety and security that they need. They can have their privacy, but they have companionship right outside their door. And then we have an assisted living as well that I will let Wilma talk about.
Okay, Wilma, go ahead.
Sure. So we became an assisted living a little over 2 years ago now. Our prior certification was residential care, and so we can provide a little higher level of care as assisted living. I think it's really important to say that, as far as nursing, deficiency-free in nursing, I think that's really important when you're looking for assisted living, is to ask about what is your history of survey results. And you're looking for somewhere where you have, the 1 or 2 or something in the last several years, not anything where you're, every year you have some deficiencies. And to add on to what Jeanette said, not only is this a beautiful home for all of us to come to every day, where the residents are family and we're their family as well. But we have a motto here. I think if you ask anybody, whether that be a housekeeper or our director of environmental services, is that, we do things right all day, every day. And anybody comes in the door and says, what's Wilma's rule? That's Wilma's rule. You do things right all day, every day. And, well, I have a second one, too. They're right, you're wrong, fix it. And I think it serves us well here. And I think that proves itself in the community.
All right. This is purely anecdotal, but I had a friend who lived there at the Village for a while. This has been a few years back, but he would invite myself and my family over for meals. So that's one of the most incredible parts about the Village is the dining experience and the chef that you have and the meals that are served. So take a moment and talk about that. I mean, that's just it's fabulous. It's beyond description, the type of meals that are available there for the residents.
So we're led by an executive chef, Nader Tarani. His background is at Lakeview and in the Pines Country Club. So he had a fan base when he came here, and he hasn't changed a darn thing he does. He still puts out a menu every day, restaurant-style menu. You order off of that menu at mealtime. There's no need to order early, a day before, anything like that. You just sit down and order in the dining room. The meals are spectacular. I've worked at other places, and when we would have people in, we would order out or have something catered, and that never happens here. People want to come here and have a meeting and be able to enjoy chef's foods. We have had to cut down people coming in from the outside because of COVID, and trying to build the staff base back up again, just like everybody else. We're all looking for staff. We have that help wanted sign out. We have some wait staff positions open. I just got back from vacation this morning, so I hear that we have filled a couple of them, so that's great. So we're going to get back to being able to have, the inviting your family and guests again as soon as we're able to be fully staffed and trained again. And it is a really great experience eating in our dining room. And it is an experience. It's not just some place where you go get a meal.
Right, absolutely. Okay, the COVID situation, and obviously hopefully we're through the worst part of it, but what did your facility learn from COVID? How have things changed permanently, and how close are you to getting back to normal?
Okay. I was on this before it started. I started watching that nursing home in Washington State in the very beginning and reached out to my CEO and said, hey, we're in trouble here. So the health system responded very quickly, to cover all aspects of every aspect of care that we provide, but especially here at the Village. I was able to get vaccines within 3 days of release. That first vaccine we had in arms here within 3 days of its release. We provided every need that our residents had. We discouraged them from going out shopping. We provided personal shopping here. Health system helped us with televisits here, so there was no need for anybody to go out of the community at all for anything. We provided everything they needed. I had my husband buying toilet paper in every Family Dollar and Dollar General store around so that we could sell that so that we could give that to our independent living residents who would be responsible to get that on their own, and they couldn't get it. So we covered everything that they possibly needed. We had a couple of very minor outbreaks here. We had just a few residents. We had nobody hospitalized. We had no deaths. We have nurses here 24/7, and we were able to monitor that. They were free to call the front desk with any symptoms. We tested them, kept them isolated from everybody else if they did get it, usually brought in by family or that they had gone out usually. But we were very successful here at the Village. And we continue to to be vigilant We have provided the second vaccine. We provided the first booster and the second booster here.
All right, very good. One more question before we take our first break, and we're visiting with Wilma Sternthal, Executive Director, and Jeanette Lancaster, Director of Sales at the Village at Heritage Point. Okay, you talked a little bit in the beginning about some of the options that are available, but you have the Village and you have the suites. So what's the difference between the two?
So independent living is just as it states. You live in an apartment. If you go out anywhere in the community and you move into an apartment or you move into a home, you're completely independent, self-sustainable. And we'll talk about amenities here in a little bit, but there's so much available for independent living here. Mm-hmm. Outside of just living in a home or just living in an apartment complex. And the relationships that these residents can build and friendships, they're second to none. And as well as, all of the activities that are going on and all of that. So it's a lot more, there's a lot more interaction than going out and living in an apartment complex in town. They can come in here and have relationships with folks that they have a lot in common with. And like I said, build new friendships, and they really become family. So that's independent living. It's, you're just independent. Assisted living is more for someone who needs help with, medication management, or need some assistance with, wrapping their legs for edema or anything at all that might require some additional nursing care or assistance with,
just like bathing, dressing, hygiene.
Yes. Yes.
Sometimes living alone, our older adults tend not to eat well because it's not very fun to make a meal for yourself and eat it. So they come sometimes with nutritional needs. And just having someone be there to eat dinner with and socialize with, it really builds them up. Sometimes you'll have somebody come who really is not in that great shape, because they haven't been taking their meds right or they haven't been eating right, and they come to our assisted living and just flourish because they have all their needs met.
Right. Okay, we'll take a break, and we'll talk about some more of those amenities when we return. Again, we're joined by Wilma Sternthal, Executive Director, Jeanette Lancaster, Director of Sales from the Village at Heritage Point. You are listening to Mon Health Talk Radio for this Monday, and we'll continue the conversation after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. The topic today is the Village at Heritage Point, and we are joined by Wilma Sternthal, Executive Director, and Jeanette Lancaster, Director of Sales with the Village at Heritage Point. And welcome back to the program.
Thank you.
Let's get into some of the amenities. You've covered quite a bit of the services that are offered there, but what else can you add to that?
Well, in talking about meals, we have covered how great the food is here. Residents can enjoy a meal a day in the dining room. We have housekeeping complimentary for them every other week, and included in that housekeeping is a little service of helping these folks take, the sheets off their bed and washing them and putting them back on their bed, something that a lot of people might struggle with and something you don't think about necessarily. We take care of all of the interior and exterior home maintenance. So if anything goes bad in their apartment, breaks down, refrigerator, microwave, anything, we take care of it right away for them. So it takes away all of that worry of home ownership, of the hot water tank going out or, the washer and dryer going down. We take care of all of that for them. We also have complimentary transportation where we will take a resident right to the front door of their doctor's appointment and come back and pick them up. So, thinking about crazy Fridays right before a football game on Saturday and how bad the traffic is, how nice it would be to just be dropped off at the front door of your doctor's appointment and then picked up and not have to navigate the traffic or parking or anything else. We have a whole host of health and wellness programs. We have exercise classes. We have folks that come in and teach Tai Chi classes. So there's a lot of that as well to keep them active. We do, I don't know a better way to say it, but they're called mind games to keep their minds, their brains thinking and fresh, some questionnaire things. So, we keep them as active as possible with all of our programs and activities. I always say that if you get bored here, it's your own fault because you didn't come out of your apartment. There's so much going on. We have activities where we will go out of the community. We will stay in the community and bring things into them. They can sign up and go anywhere they want to go. We go to the grocery store several times a week. So whether we do their grocery shopping for them or they want to go and do their own, we'll do all of that with them. We have beautiful grounds here. It's something that's to be said about Morgantown is there's not a lot of flat ground here. So we have a beautiful walking path that goes almost completely around our building. Beautiful landscaping. We have some gazebos with rocking chairs in them. Pond with a fountain in it with fish and ducks. We have a couple of resident ducks who live here, Buster and Charlie, who are fed well. And they are sure to take care of their pond and keep out anybody that's not supposed to be in there. It's quite comical to watch them chase out the other ducks. There's fish in the pond, and the residents just really enjoy. I see a lot of times after dinner, they'll just sit out there at the benches around the pond and just, watch the fish and watch the ducks and all of the wildlife going on. There's a lot of, like I said, nature here, and then we're in the middle of a medical mecca. We're right in the middle of a huge, campus of HealthWorks and Mon Health Medical Center and all of the clinics around us, but yet it's serene. You walk outside and you hear the birds chirping and you hear the nature, and it's not busy highway, and it's not, you don't feel like you're in the middle of town, but you really are. So it's really beautiful here, and a lot of the residents, they'll tell you the same thing, that those are some of the best amenities that we have is the outside, how beautiful it is, and how they can go outside and go for a walk if they want to.
Yeah, you've painted an incredible picture there. That was a phenomenal job. All right, we've got about a minute left. So what about tours? What about interested potential customers and residents? What would be the steps they need to take?
So they can go on our website, heritage-point.com, or call us at 304-285-5575.
Okay.
And if they're interested in a tour, they can get a hold of me that way. I would schedule with them. I usually allocate a couple of hours for a tour so we can really see the whole community and really talk about everything that we have to offer with them and their options.
Okay. So, again, very simple. Just call the Village at Heritage Point, set up a tour, and they will roll out the red carpet for you in terms of seeing the facility. Ladies, very good. In the final 30 seconds, anything quickly that we haven't covered?
No, I just like to say, a lot of people say, I'm not ready yet, and the time to be ready is sooner than you think, because you want to be able to come here and enjoy everything that we have to offer and make long-term relationships.
Yes, absolutely. Very good. Well, again, great information. We appreciate the time. Wilma Sternthal, Executive Director, and Jeanette Lancaster, Director of Sales, the Village at Heritage point. Again, ladies, thanks for the information, and we'll talk to you again.
Thanks,
Thank
Kyle.
you.
All right, thank you.